Welcome to the Ethics, Boundaries, and Professional Behavior module in the Training for Community-Based Living Arrangement certification by the Nevada Department of Health and Human Services, Bureau of Healthcare Quality and Compliance. To start off this module, let's talk about what ethics means. You can define ethics in several ways, starting with the moral principles that govern behavior. Other terms that help define what ethics is include morals, value and value systems, right and wrong, principles, ideals, standards of behavior, and conscience. As a larger topic, ethics is the branch of knowledge that deals with moral principles. But then this large topic boils down to the basic concepts and fundamental principles of decent human conduct. The specific concepts that are unique to you as a community-based living arrangement provider include health, safety, equality, diversity, and client rights. Understanding the need for boundaries involves both the benefits of the boundaries and the consequences of not having them. Having healthy boundaries between clinical mental health workers, CBLA providers, and clients is essential for appropriate emotional and therapeutic support. By contrast, the lack of clearly defined boundaries and having dual relationships involving both personal and professional roles confuses clients, increases their dependency, hampers their recovery or progress, and reduces the development of natural support systems. The trick here is that as a CBLA provider, you need to be sufficiently involved with your client so that you can offer him or her effective care. Yet you have to refrain from getting so involved with them that you hamper your ability to effectively attend to their needs. Remember, you have a job to do. An element of setting personal boundaries involves your personal values and beliefs. As a community-based living arrangement provider, you are not to impose these personal values and beliefs on your clients or try to convince them to affiliate with any organized group, religious or political ideology, or organization. When it comes to your own personal information, CBLA providers shall avoid revealing intimate personal history or information about themselves to a client with whom they have a direct therapeutic role, or to another person with whom the client maintains a close personal relationship, unless there is a specific therapeutic purpose for that disclosure. You want to have a good personal relationship with your clients, but it's much better for your professional relationship that they don't know personal information about you. If you do tell a client personal information for a specific therapeutic purpose, you must document it in their record. And you definitely must not share specific personal information such as your home address or phone number with a client. As a hard and fast rule for you and your staff to follow, CBLA providers shall not knowingly establish or engage in a personal relationship with clients or with the client's family members or significant others. This is true even with former CBLA clients, as it is prohibited for provider staff to have personal relationships with former clients with whom a therapeutic relationship has occurred. As with any incident that violates the rules of certification or license, HCQC will assess any questionable relationships and, if necessary, conduct an investigation to be sure CBLA clients are safe. The biggest no-no of all is romantic relationships. Under no circumstances may CBLA residential providers engage in a romantic relationship or a sexual activity with clients or former clients with whom a therapeutic relationship was established, and it doesn't matter how much time has passed since termination of that therapeutic relationship. Providing community-based living arrangement services to clients is a business relationship, but other such relationships are forbidden. CBLA providers are strictly prohibited from engaging in business activities with clients or former clients as long as there has been a therapeutic relationship. And these activities include, but are not limited to, loaning or borrowing money, trading, bartering, or profiting from the sale of goods to the client or former client. When it comes to gifts, CBLA providers shall not accept money, gifts, services, or special privileges in any amount from clients or others with whom clients have close personal relationships. Exceptions to this general rule include personal interactions that occur within the context of events in which staff, clients, and families participate together, such as holiday parties, social events connected with a therapeutic environment, CBLA, or unit, or similar occasions in which participants come together because of their connections within the community-based living arrangement or related activities. When CBLA staff are not on the clock, they are not allowed to perform work-related activities on clients' behalf. If you believe an ethical violation has occurred within your community-based living arrangement environment, you should immediately fill out a self-report form on the Bureau of Healthcare Quality and Compliance website. The web address is provided on the slide, and the direct link is also available on the NV eLearn webpage for this training module. This is the end of the Ethics and Professional Conduct module of the training for Nevada Community-Based Living Arrangement Certification. You can now proceed to take a short test, and when you pass the test, you'll be able to print and download a certificate of completion.